Today we're going to review image acquisition for renal and bladder. So typically you'd start on one of the sides. Most patients come in with flank pain. And so we'll start here at the right flank. And I have the indicator towards the patient's head. And typically I start in long axis of the kidney. And you can see the liver here, which is a great echogenic window. And you can see the cortex of the kidney here. Try your best to center the image. And like any organ, you want to fan through it all the way, and you're looking typically for hydronephrosis. You can see cysts, and you can see kidney stones as well. Those are more common things we look for in the ER. So you fan through in a long axis, and then you turn the probe, and now you put the indicator typically towards the back, and now you can see it's more circular, and then you fan all the way from the inferior pole up to the superior pole. These are rib shadows. Sometimes you got to work around them. A breath can help with that if needed. A lot of times just being patient and you'll get the view you need. Then I switch over to the patient's other side. Same thing, you start in long axis. You can see here's a nice long axis here of the kidney. You can see the cortex. And you fan through all the way. And then you turn the probe as well to get a short axis, more of a circular view, and you fan all the way from the inferior pole up to the superior pole there. For measurement purpose, if you're going to measure, you can measure in both views. You can measure a nice long axis here and short, depending on your clinical suspicion. And then typically I also finish with bladder view, and you can sometimes you can see the stones in the bladder or right at the UVJ if you're looking for kidney stones. If you're doing this more for measurement, you can measure for a urinary retention patient or a neurologic presentation. But you can see here is the bladder. There's a small amount of urine in it, and so I fan all the way down, all the way up. Right now the indicator's to the patient's right, and then I'd switch to a long axis view. And same thing, here's your bladder here, and I'd fan patient's right and patient's left.